Hello, everyone. I'm Mary Jones. I serve as chair for the Kansas Behavioral Sciences Regulatory Board. I ask that the members of the board to respond to a roll call to signify their presence at this open meeting that is being conducted in hybrid form with some attendees in person and others attending remotely by conference call or other electronic medium. David Anderson.
Present.
Donna Horner-Quall.
Present.
Jim Kilmartin.
Present.
Jacqueline Nightcap.
Here.
Richard Nobles.
Present.
Jonna Norton.
Here.
Andrea Perdomo Morales.
Present.
Cynthia Schendel.
Present.
Deb Stidham.
Can you not hear me?
Oh, there you are. Okay. Hi, Deb. I note that the following staff members are also present. David Fye.
Here.
Cindy Durkle.
Sure.
And Assistant Attorneys General Lainey Bernard and Jane Weiler are also present, as is Paul Keithley.
And Mary, I have not seen Lainey enter the Zoom yet. So
Okay, that's what I was looking okay.
Yeah, I'll let you know if she goes ahead and signs in a little bit later. So
Okay.
Madam Chair, this
Yes.
is Jane Weiler. Lainey Bernard might be appearing by telephone.
Okay. Thank you very much, Jane.
okay, and we do have the conference call line open. I checked before the meeting started. Nobody had beeped, but if I do hear a beep, I'll let you know.
Okay, and we will note that we have members of the public to present public comment today. Would you please introduce yourself? We'll start with Leslie.
Hi, I'm Leslie C. Wester. I'm here representing the Heart of America Professional Network. So I know many of you, but that's why I'm here today, just to provide some public comment.
Any others on the call to provide public comment?
Hey everyone, this is Don Oliva from CE Broker, and I'm here to present on the continuing education tracking and management software for licensing boards.
Thank you, Don. Is Todd on?
Oh, yeah. Hi, good morning.
Hi.
I'm Todd Fry. I'm here with Tana Arnold, and we're here to talk about interpretation of a statute for a doctoral program. So thank you.
Good to see you. Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Mary. And Lainey Barnard did go ahead and enter through the Zoom, so she is present now as well. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the board about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the board to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. A representative from CE Broker has been approved for about 15 to 20 minutes to present information to the board. A representative from Heart of America Professional Network has been approved for up to 15 minutes to present information to the board. And a representative from Mid-American Nazarene University has been approved to provide public comment to the board on KAR 102-3-7AB for up to about 15 minutes. Because we are conducting this meeting publicly and in hybrid form with some attendees in person and others by remote, by conference call or other teleconference ability, I state for the record the following information. Access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended. As such, we'll be conducting this meeting pursuant to KOMA. On August 23rd, 2022, we sent notice of the board meeting to all individuals who had requested notice of the meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting materials were posted on the board's website on the day of the meeting. You may also request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information on the ability to attend the meeting, either in person on this call or in the conference call or on the YouTube channel. And that is free of charge. The notice also indicates that If there are any individuals who request a copy of the agenda, they can send an email to the BSRB at bsrb@ks.gov or to the executive director at david.fi@ks.gov. If you experience any issues or technical issues during the meeting, you may also send an email to bsrb@ks.gov or call the board office at 785-296-3240. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda.
Thank you. The meeting is now called to order and the board will begin its discussion of the first item on its agenda, which is the agenda approval. The board should have received the agenda in their packet of information. Are there any changes or discussion on the agenda items? If not, I'll take a motion to approve the agenda.
So moved.
Thank you,
Second.
David. Thank you. Is that Cynthia?
Yes.
Okay, thank you. All those in favor, please say aye.
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 Any opposed? Thank you. Next item of business is to welcome Jim Kilmartin to his first official meeting. We've seen him in some other meetings, but this is your first board meeting, so welcome, Jim.
Thank you. Appreciate it.
The next item on the agenda is our public comment, and we will begin with the presentation on alternative continuing education tracking system from Don Oliva, excuse me, sorry, Don, who's with CE Broker.
Wonderful. So I'm going to go ahead and pull up a presentation, but I have a slide presentation that I want to share with you all today that'll kind of give you a high level overview of how CE brokers worked for other states. And then afterwards, I was going to quickly log into some of our accounts just to give you a look under the hood as well. Let's see if we can make this full screen. Can everyone see the CE broker slide okay? Fantastic. I know we have a loaded agenda, so I will jump right in here. So to put it very briefly, CE Broker is a unique software company that partners with licensing agencies to really simplify and automate the process of continuing education. And our biggest selling point has always been that we're able to accomplish that without enforcing any mandatory cost or burden on the primary stakeholders. We view those stakeholders as the education providers or course instructors, the licensed professionals, and then the regulatory board or the state agency. We also think that just about everyone can agree that CE compliance, or at least the audits and enforcement process, is notoriously a headache, both for licensees and for staff members at the agency to manage. So we do what we can to simplify that process wherever possible and make it more manageable for both parties to deal with. And on the screen here, you can see a helpful graphic that really breaks down how CE Broker works and shows how the data is flowing. So as you can see, information is coming in from licensees, from CE providers and course instructors, and from state boards, and all of that's aggregated onto one platform and broken down by a comprehensive compliance engine that we customize to each state. So there really is no one size fits all with CE Broker. We do tailor the system for each individual licensing board and jurisdiction. And within this platform, we're proud to have created the single largest CE marketplace in the country. So our core search delivers a streamlined experience for licensees to not only find board approved courses that satisfy their requirements, but to also take those courses from reliable, high quality education providers who they can trust to report the completion record back to the board. It's also important to mention here that CE Broker doesn't create or offer continuing education courses of any kind. We're really just the neutral platform or the hub that aggregates those approved courses from third-party providers. As far as our history goes, we were founded back in 2003 and started tracking for Florida's Department of Health, which did include their counseling, social work, marriage and family therapy, and mental health professional licensing board as well. And that's where we were essentially born into the realm of continuing education. And our platform was built in response to an RFP that they put out for a CE management platform, with the backstory there being that Florida needed a CE system, but they didn't have $1 million lying around to sink into building one themselves. So they asked vendors to come up with a creative transactional or freemium model that would allow the state to implement this sort of technology without a large upfront cost. So that's kind of where CE Broker's unique subscription model came about. And it really wasn't until the last 6 or 7 years that we started looking outside of Florida, kind of recognized they weren't the only ones dealing with issues managing their continuing education program and audits. So since then, we've grown exponentially and have now expanded to track for more than 130 licensing boards across the US and we have a presence in 23 states today. And among that population, we support a network of more than 10,000 education providers. And they are listing courses on our platform and actually reporting the attendance rosters or completion data directly into our system. So that's really the secret ingredient that makes this so valuable to licensing boards and to auditing staff members. So if Jane Doe goes and completes a course from continuingeducation.com, the next time she logs into her CE Broker account, she can see that those credit hours were reported directly from the provider without having to worry about self-reporting it, or maybe losing a copy of her certificate somewhere over the 2-year renewal process. And then beyond that, we have experience tracking for more than 200 unique profession types. So needless to say, if the profession has some sort of continuing education requirement or a competency component, it's more than likely something that we've dealt with in the past. And on the map here, you can see a visual of our growth over the last couple of years. We are still largely concentrated in the Southeast region, but the most important thing to note here is that our current partnerships include a variety of umbrella agencies. So we'll have groups like Florida's Department of Health or South Carolina's Department of Labor Licensing and Regulation, where it includes everything from mental behavioral health to dentistry, nursing, medicine, and every profession in between. But we also have experience with independent or autonomous boards as well. Specifically in the field of mental or behavioral health, we have a number of different boards: Florida, South Carolina, Ohio, Tennessee, Wyoming, Michigan, West Virginia, and North Carolina. So it's certainly a field where we do have experience. And this is just an overview of our growth over the last year. We brought in more than a dozen new boards, totaling nearly 250,000 licensees across a wide range of profession types. And we're excited to more than double that growth in 2022, as we're expecting closer to 1 million licensees this year. But with that growth, we also believe firmly in remaining responsible corporate citizens and try to give back to our communities wherever possible. So whether that means donating to causes that we care about or just volunteering within our communities, we do what we can to ensure that our values aren't just a plaque on the wall, and we actually stand behind that. And then obviously in today's day and age, privacy and security are paramount for any organization. So our platform is compliant with Federal Information Processing Standards, or FIPS. We're also DSS compliant and have geo-redundant data servers in Jacksonville, Florida and Louisville, Colorado that help us ensure stability and high uptime for our clients. But aside from this, the main way that we protect ourselves as a vendor is just by avoiding any personal or sensitive data. So anytime CE Broker contracts with a new board, majority of the information that we collect is already public facing on the license verification pages for consumers. So that would be things like an individual's name, their license number, the issue date of their license, and the expiration date of their license. But if the information doesn't affect your CE requirements, we don't require it for tracking. So an example that I always like to point to would be things like an individual's birth date. In some states, an individual's birth date actually influences when they renew their license or their expiration date. So that would be an example of when we would need to know someone's birth date. However, outside of that, it's something that we don't collect or require. So we try to operate as lean as possible and never collect anything like social security numbers or any private data beyond just simple contact information. And really a primary benefit to the platform we've developed is that each of the 3 main stakeholders that I mentioned earlier all receive their own unique login, which allows them to come on and complete their own piece of the puzzle. So whether you're an education provider just signing on to submit an application and get a course approved, or maybe report a completion on behalf of a licensee, or a licensed professional just logging in to get a quick overview of your CE requirements and report a class that you've taken, you're able to log into CE Broker for free and handle your half of the equation without any paperwork required. And with that, I wanted to kind of hop over here and give you all a quick glimpse into how this platform looks and feels for the everyday user. So the first example I've pulled up here is our continuing education course search. So again, the important footnote here is that CE Broker doesn't create any CE or education content. We really just coordinate with the approved providers to get their courses listed on the platform. But right now I have it set to a licensed mental health counselor in the state of Florida. And then from there, it's kind of like a sandbox environment, in that every course you would find on this listing has either been directly approved by the board or it's been accredited by the appropriate national association, whether it's NASW, ASWB, APA, or any of those national groups that the board has kind of outlined within the rules that they'll accept. You can find those courses on our platform. Licensees can filter the course search in a variety of different ways. So if maybe you're on a budget, you just want to see what kind of free continuing education is available, you can punch in that filter and then start seeing, how many free courses you can find, and possibly even complete all of your renewal requirements without actually having to spend any money on continuing education. And a lot of the large providers in mental health like PESI are already reporting completions directly into our system. So that creates that scenario I mentioned earlier, where a licensee logs into CE Broker sometimes for the first time, and they see that there's already credit hours that were reported within their account because the provider of continuing education reported the completion for them. And with that, I'm going to hop over into the licensee account here, and we'll make this full screen. And this is just a quick glimpse into the licensee account. It is a test account for an occupational therapist, but the look and feel is basically the same. The only thing that changes within this account would be the CE requirements that we're displaying to the licensee. But we can see this individual is 84% of the way complete, has their state, license number, CE cycle. At the bottom, they have access to their course history. So that's where you could see anything that you've already reported, along with anything that's been reported by an education provider. And then you can view the transcript here as well, which will have how many hours the licensee has already reported, how many hours they still need. Florida has a laws and rules of the board requirement, a general CE requirement. Looks like this individual has already met their medical errors requirement here, but they still need 2 hours for their general CE requirement. And the system's even telling them, hey, we found 8,000 courses that'll fulfill this requirement. You can just click that button. It'll take you right over the course search, and you can start browsing approved continuing education to fulfill your remaining requirements. Another important call out with this account type is that CE Broker can track things that go beyond just your average CE course. We recognize that a lot of state boards have language within their rules that specifies certain types of professional development activities can count as credit for continuing education. Some of those examples in Florida would be being an editor of a book directly related to your practice, supervision of a student, lecturer of a course or program, or author of a peer-reviewed article. So we actually have built out basically a little path for each of those. So when you're going in to report CE in the state of Florida, you choose what type of activity you're trying to report, and the system will even instruct you, exactly how to report it. You can click this little widget. It'll walk you through step by step. Or you can click learn more, and it'll even cite the specific board rule, which explains what type of credit would count and what type of documentation you need to upload. And then from there, the licensees answering a series of questions about the activity, they upload a copy of their certificate or any supporting documentation and then submit. And it's basically as easy as that for reporting education into the platform, even if it isn't, your average CE course. And then last, but certainly not least, I wanted to give you all a quick preview of the board suite, which is essentially the login perspective that David and his staff would have access to on the administrative side for the board. But this is where things really get interesting, because all of that data that CE Broker is aggregating is available to the board at their fingertips. So if you wanted to pull a report that said how many of our licensees are compliant with their CE requirements versus not compliant, you could pull that on any given calendar day to even more detailed information. If there's something like an ethics requirement or a specific subject area, you could also pull that information directly within CE Broker and have access to it. And then beyond that, the board is able to complete audits through this platform as well. And we find that it is very rewarding to individuals that are kind of proactive with their education requirements. Because traditionally, the process is the licensee will attest to meeting their continuing education requirements. If they come up in the random audit, they're required to submit copies of that documentation to the board. Where things can actually improve a lot for staff with a platform like this is that any licensees that are already reflecting as 100% compliant, David and his staff would have access to that information within CE Broker. So when they're selected for audit, we're often able to cut down that waiting period where it might be 2 to 4 weeks before the licensee responds after receiving notice of audit. And all that documentation is available to the board here 24/7, 365. And with that, I wanted to kind of pause for a moment here and allow the board members an opportunity to ask any questions or maybe identify some additional areas where I can provide you with a little more information.
Members of the board, do you have any questions or comments?
I noticed on your map that Kansas was colored. So what boards in Kansas are already using your service?
Absolutely, it's a great question. The Board of Nursing was the first in the state of Kansas. And then most recently, as of September 2nd, actually, the Board of Healing Arts as well is going to be using this. So that'll cover everything from medical doctors, physical therapy, occupational therapy, and a lot of different professions in between.
Thank you.
Other questions, comments?
I had a question, Madam Chair. I'm curious about the access to all, do we get access to all these other groups? Continuing ed, is that, I hear you say you're a broker, so like which systems would we have access to and how much would that cost the licensee? Is that going to vary?
Yeah, and do you mean you as in board members or just as licensed professionals?
As a licensed professional, yeah.
Yeah, so as the licensed professional, there's no mandatory cost or fee to using CE Broker. That's kind of the most unique aspect of this platform, is basically that when we launched with Florida, they didn't have funding. They needed vendors to create a funding model that would allow the state to use this kind of technology without a large upfront cost. So right now, there's about 3 million licensees that use CE Broker. It's roughly 85% use our free basic account, which allows you to get through the entire process on your own. It doesn't cost you a dime to take advantage of. The only way we actually generate revenue are through voluntary subscriptions. So we have a professional account that's $29 per year that can automate a lot of the process for you, and even a concierge account that's $99 per year that can essentially give you a personal account manager. They can report CE on your behalf, respond to an audit, do basically everything other than take the courses for you. But that's the underlying funding model behind CE Broker, is paying for added convenience.
So I'm seeing what I was actually asking about. So it talks about under the concierge service, we find approved courses for you. So I guess what I'm still wondering about is, are there any of these warehouses of courses that would be at low cost, no cost?
Absolutely. Yeah.
Okay.
And you don't even need a CE Broker account to go over to our course search. But that's something I just want to clarify again. CE Broker doesn't create or offer any continuing education. We coordinate with those approved or accredited providers to create like an easy course search so that licensees can find a course and have peace of mind. The scenario that we try to avoid is where you go to Google, you find some course, it might be accepted, let's say in the state of Texas, but it doesn't meet Kansas state requirements. CE Broker can eliminate that. You are already basically dialed into each state and each profession type. And then from there, you can punch in a filter. We have a filter for by price, and then it'll show the lowest price courses. And you can see for Florida, there's a lot of free CE credits from Baptist Health, USF, North Florida, PESI. A lot of different providers have courses on here, and you can take as many as you can and try to knock out all of your CE requirements without actually having to spend anything.
Okay, thank you.
Not a problem.
And I'll add a little bit of information here too. So board members in general, so if we contract as a board with an outside entity, a different company, the general rule is if that threshold for the contract would have a value over $5,000, we would need to put it out for a formal RFP process. Now, there are certain exceptions if you contract with, let's say, for example, state agencies in Kansas, or there's a couple other exceptions. But as a general rule, if the cost to the board would be over $5,000 per calendar year or per fiscal year, we would need to issue an RFP if that's something that we would contract with. And so I just wanted to clarify, Don, you talked a little bit about what the potential cost would be for the licensees. Could you talk a little bit about what the potential cost would be for the board if the board wanted to contract for these services?
Absolutely. So to clarify, there is no cost or fee to the agency for implementing, support, customization. That's just not within our funding model. Our contracts with licensing boards very clearly spell out that there will never be a cost or fee to the state for using CE Broker. And that even includes, like I said, if your rules ever change. So if there's a new CE requirement that comes through legislation, or you even modify an existing requirement, we make all of the changes and updates to the platform with absolutely no cost or fee to the state.
So if the board were to contract, if the BSRB were to contract with CE Broker, how long does it take you to set up our site for mental health?
It's another great question. It's typically 90 to 120 days from having a contract signed to having the platform live and ready for the licensees. And most of that work is on our end. To be honest, a majority of the work is just going through your rules and regulations to map out every possible scenario of continuing education requirements based on license type. And we would go through and ask David a series of questions. You know, what if I'm licensed in a leap year? If I'm on military leave, do I get an exemption for my CE requirements? And we combine all of that information to make it so that when you're logging in as a licensee, it's linked to your license number. You always see the relevant requirements for your specific scenario, no matter how complicated it may be.
Are there any other questions or comments? Okay, hearing none. Don, thank you for your time. We appreciate you being here to provide your comments and your information.
Absolutely. Thank you all so much for your time as well. And I know that David put together a packet with some more information on CE Broker, and that'll include our formal proposal and even letters from other states that we recently had to pull that speak to their experience with CE Broker as well. But of course, if any other information would be helpful, just feel free to reach out. We're more than happy to share additional references and information as needed. Thank you all again.
Thank you. Moving to the next item of the agenda is Leslie C. Wester, who's here to talk about the impaired provider programs.
Good morning, everyone. Thanks for taking some time with me. As you all know, I recently took the position of executive director here at Happen. So I'm on my third month. So all the information is pretty fresh, but I think I've learned enough. I can give you some basic information and maybe provide a brief background and of what the program does. I did not put together a slideshow or formal presentation. I just did have David attach the brochure for you all. So you do have that information. Just the first part that I will read is that Happen, it's called Heart of America Professional Network. We are an organization that was developed back in 1992, I believe, that was developed to address the problem of impairment among various professional groups. So currently, we work with the Board of Healing Arts and the Board of Nursing, along with the Dental Board and the Veterinarian Board and optometrists. So back quite a while ago, I think it was maybe 2011, I could be wrong on that year, but we worked with CAP when they had substance abuse with the addiction counselors. So we did have a memorandum of understanding or agreement with them to provide services to impaired providers. So basically what we do is we can receive referrals from the boards or from the professionals themselves or other professionals who are concerned about the other professionals. So even like an employer, sometimes we'll receive about nurses, we'll receive concerns from employers. Right now, that doesn't have to go through the board, but that doesn't mean that that's how, if this board chooses to utilize this program, that that's how that would have to be. We could put together information however the board would like that information to be shared or how that process would work. Right now, if we receive a board referral, it just comes through to us as, hey, this is an impairment, or maybe the professional received a DUI and they're just wanting that extra care given to that case. They'll send it over to us and we will have an evaluation, substance abuse evaluation or mental health evaluation conducted. Then it comes back through to our agency for review. And we determine if there's any additional level of higher level of risk or impairment that would cause problems for that person to be employed or working in their profession. If that's the case, then we can recommend anywhere from 1 to 3 years of monitoring. And the professional would be required to we would receive reports from their employers. They would have urinary drug screens, and we basically just hold them accountable for, maintaining sobriety and working with them hand in hand. And we have monthly meetings. So it's similar to what you would see in a in a court setting for a diversion. However, it's less punitive, and we are the, the professionals that are helping the professionals. So impaired provider program means that, we're going to work hand in hand with them. So our goal is to work together with the boards to have that accountability, but also that support in more of a helping manner in the profession, and to protect the community along with the boards. That's one of our main goals. As you all know, ethically, as professionals in our field of social work or other professional counseling, et cetera, ethically, we have to, we're responsible for reporting impaired behavior and unethical behavior. And I think over time, that's been very difficult for professions in our fields, because they're afraid of what the repercussions would be for them. So this gives the avenue for them to report that behavior through a different way, where it's not going directly to the board. So that's another thing that we do with nurses, that they can report to us. However, if there's any non-compliances or any issues with that person, the professional knows that we report that directly to the board. So that's just kind of in a nutshell how we do things. I think you all kind of know my background. I'm an LMSW and a clinical addiction counselor. So I work very closely with the initial referrals that come in. And if we were to work with this board, I would work directly with the people, the professionals that would come in from this board. So I would look forward to any questions. I do know that Jane Weiler is on the call, and she's worked with Happen in the past. So if she wants to provide any additional information, or if I don't know the answer, she might, because again, I've been here 3 whole months and it's been exciting, let me tell you. So is there any questions that can open it up? Hopefully I can answer them, and I can definitely provide, additional information if you want to move forward.
One question I have is whether my understanding is that if you're aware of an impaired professional and you're a licensed professional, that you are required to report that to the board. So would a partnership with Happen allow that to be changed, or would that require a regulatory or a statutory change?
I don't know the answer to that. I'm not sure. That's the nursing program. We do that with the Board of Nursing, and other impaired provider programs in other states don't require that. But we do work closely with the board. We are reporting that there is an individual, but it's an anonymous report to the board that they know we're working with them, but we don't provide a name. So I don't know if that's how they get past, changing any reg or anything like that. But that is a good question. I'll check into that, Cynthia.
I think that raises a really interesting question, and something the board, I think, will maybe even should consider now. I mean, are we putting people in a double bind to getting the help that they need? And I think it's probably not unusual for these kinds of rules to inadvertently do that. But I think it would be a really good thing for us to look at.
Yeah, Deb, I appreciate your comment too, understanding that, we haven't had a resource for people if they did want to self-report or if someone reported for them. So with this particular program, just to be clear, the way you have it structured already is voluntary anonymous, voluntary known, or referral from the BSRB. That's sort of the 3 things I'm identifying.
Correct. Yeah, and I will just say, I would envision we would work closely with the CRC, and then there's some that, when there's clinical supervision, there's other areas that we can get into of monitoring. So I know now that the board does that themselves, and the staff are required to track some of that. And those are some things that we can help the board with, some of that additional work that they do that seems outside of the realm, in my thinking when I was on the board, that there should be some other way to help with the tracking or, the monitoring of that. There's so many times we've talked about, well, is the clinical supervisor actually signing that? We have ways of tracking. Our participants will go through AA meetings. They have to have a monthly meeting with us. The drug screens are tracked through a system. Everything is really, fine-tuned. I was very impressed with how they manage things around here, and was very fortunate to come into a program that really works for these professionals. And I've been impressed with the success of the program. So.
Go ahead, Richard.
So that I have a kind of a clearer understanding of something. When it comes to the monitoring that you had discussed earlier, you said that folks can be monitored from 1 year to 3 years. Is there any mechanism for determining during an intermediate point whether or not the monitoring can be either extended or reduced? And what would that look like on your end?
Certainly. So with the 1 year is the minimum that we've had so far. It takes, if you look at studies, it takes quite some time really to get into impairment, because those issues are triggered by maybe anniversaries or things that come up with the individual. So we try to have 1 year be the minimum, and then as far as the 3 year, that's just what our program, how our program exists to have a number. We have reduced that number for several professionals. If they're doing well in the program, things are going great, then yes, we can reduce that. If they're not doing so great, we've had people that have returned to the 3-year program and they've been with us for 5 years. So it just varies, and it's very individualized. We go through each case every month and review how they're doing and kind of audit those cases just to make sure that we're not over, having the requirements that are unnecessary. So we don't want to over monitor. So yes, the other part is for nurses. That's not so much for our professionals here at the BSRB, but nurses, since they have that direct care with clients or with patients, we have to sometimes deem them as unsafe to practice. So that's a very significant, item that we're responsible for here. And we sometimes they will not be allowed to work in their profession until they have some time under their belt to say, yes, I am in recovering and I'm doing very well. So a lot of responsibility on this agency to make sure that the public is safe. So thanks for your question, Richard. That was a great question.
Leslie, if I understand this right too, you also talked about mental health evaluation. So is there a track essentially that isn't involving substance use disorders, but involving mental health issues that need to be monitored differently?
Yeah, I mean, if I'm being honest, it's very similar. And that's not to say because mental health can, as we all know, right, it can be both, and mental health and substance abuse. If it's clearly mental health, then yes, it takes a different track as far as we may not require as many urinalysis tests, or we might not require as many prescription check-ins or things like that. But as far as the treatment and the evaluations, the initial evaluations, and then updating those as needed, that's the difference would be just in their programming, what we require them to do. And it's so individualized and case by case. I can give you case examples in the future if you all want that additional information. But yes, mental health a lot of times goes hand in hand with substance abuse. We're seeing more and more of that, unfortunately. But yes, it does get treated differently.
Other questions or comments?
So if we talked about next steps, that would be, obtaining more information and anything additional that you all requested of me, I can send additional information. I do have where I can send Dave the MOU, memorandum of understanding that we have with other boards and board contracts, just to give you an idea of what that looks like. If you'd like that information, I can share whatever you need for that.
Yeah, I think that'd be helpful. Thank you, Leslie.
Okay. And Jane
Well, thank
didn't
you.
say one thing, so she loves the program, right, Jane?
I will just say, when I was at the Board of Healing Arts, I did work very closely with Heart of America Professional Network. I was the attorney that did monitoring. And so I had like around 100 licensees that were not all with HAP, and some were with the Kansas Medical Society, the medical doctors. But I understood their program. And when I came to the Attorney General's office, right away, one of the boards I had was the Board of Veterinary Medical Examiners. And we had an issue right away that was an impaired provider, and there was nothing in place. So I reached out to Happen, and they were able to establish something very quickly. And some of my CRC members have heard me mention it before, that we've had a few cases that it would have benefited to have some impaired provider program available for the CRC to consider some type of a follow-up. So it is something I am familiar with. I'm not familiar with this Sylvester person, but.
Yeah, y'all just thought I went away, didn't you? Anyway, but yeah, thank you, Jane. And whatever you need, let me know. I'm looking forward to if we can work something out. I think it would be a really good program for the, our professions for sure. So looking forward to it.
Thank you, Leslie.
Thank you.
We will move to the next agenda item, which is Todd Fry here to comment on KAR 10237AB. Good morning, Todd.
Yeah, good morning, everyone. Just a brief introduction. I'm Todd Fry. I'm the department chair at Mid-American Nazareth University in the counseling program. I see some familiar faces. I was on the board for 8 years. So I'm so thankful for all that you guys do. I understand the sacrifice that you make to spend this time. And so we will hopefully use it efficiently in our conversation with you. We want to be really transparent up front as to why we're here making this comment. And so I'm gonna let Tana kind of fill you in a little bit. I've supervised Tana in her postgraduate supervision. And so our question relates to the interpretation of 102-3.7AB of the BSRB statutes.
Oh, hi, everybody. I'm Tana Arnold. As Dr. Fry mentioned, here just to kind of ask about the statute that talks about doctoral degrees having half of the supervision requirement, and the interpretation that the doctoral degree needed to be completed before the training plan was approved. The way the statute's written, it sounds like, and the way I interpret it when I first read it, was once you had the degree, it was half the supervision. And then when I had reached out, I was told, no, the degree had to be done before the training plan was approved in order to have the halftime supervision requirement. And just wanted to talk to you about the interpretation of that. Yeah.
So we have two primary questions, and I was trying to think back on my time on the board, the original rationale for allowing the half amount of supervision and practice. So the first question is like, what does anyone remember the rationale for allowing that? Or what is the board's rationale for allowing that? I have some ideas in my head. If I was on the board still, I could probably try and answer, but just wondering.
Yeah, and Leslie couldn't join us today, so I'm going to defer to David to sort of step in here and see if he can round out that specific question while I'm
Sure.
pulling up the regulation.
Yeah,
I'm
I'll
sorry, I
go
should have
ahead-
said it's in the professional counseling.
Yeah, regulation. Yeah, yeah.
Sorry.
Yeah, I'll share my screen here. This is a copy of KAR 102-3-7A. And just to kind of put a little preface to this conversation. So this is something that the BSRB has looked at in the past. And when somebody is attaining hours towards a clinical level professional counseling license, there is a regulation, here it is highlighted B, that says each applicant with a doctor's degree in professional counseling shall complete a minimum of 1/2 of the postgraduate supervised professional experience requirements as follows. And so from my understanding and talking to Leslie Allen, historically what they did is when someone was going to be submitting a training plan, they would look to see, does the person have a doctor's degree? And then if they do, they're able to submit a training plan that would coincide with a certain number of hours and different things like that. And so the way that they've done it historically, from my understanding, has been if you have the doctoral degree, then you can go ahead and submit the training plan and corresponding to this under B. But since this is something that there were some questions about, we wanted to bring it towards the board to allow you to review this and discuss it. And Dr. Fry, I appreciate you coming towards the board and discussing this today. In our discussions ahead of time, I wanted to make it very clear, this is something not really specific to a certain candidate. This is something more so to make sure that we're consistent with all candidates who apply for licensure. So this is the instance where it came up for question, but really for the BSRB's perspective, we just want to allow the board to discuss this point so we would know what to do in this instance, but also to make sure that we're consistent for people moving forward as well.
Yeah, that's good. I think for us, the rationale is important in forming the interpretation of this particular statute. And so still kind of wondering what the rationale from the board is on why this exception is being made for those with doctoral degrees. And trust me, I am for it as someone who has a doctoral degree, but wondering what it was the original rationale of doing that. Again, because it may help with interpretation of the statute.
Any board members or perhaps even attorney input on rationale behind this one? I would only be making assumptions, so I don't want to speak for that. Richard, I see your hand up.
Yeah, I wasn't on the board when this was discussed, but if we pulled the psychologist's code or the psychologist regulation on supervision, I'm wondering if this regulation parallels the regulations for psychologists. And maybe that might be the rationale for it. But I don't know.
So could I throw out maybe some potential rationales that I might think might be reasons why, if I were sitting in your shoes? I think most doctoral programs require a clinical practice component of the program. And with that clinical practice component of the program is required supervision that's done by someone, and similar as a master's degree program, but some doctoral level faculty member that supervises that experience. And so that would be an additional practice experience on top of the experience that they would be doing towards their clinical license. And as an advanced level degree, they would have further knowledge and understanding of the profession, which in turn, both those things would protect the public more, would be a nice supplement. Again, I agree with that. That would just be my rationale in understanding that. And if that's the board's rationale, then we have a couple other questions related then to the interpretation that someone needs to have this in place prior to the completion of their plan that they submit. Because we would argue that if that is a good rationale, which I believe it to be, then anyone at any point who completes that doctoral degree should be given the half requirement. So if someone were in a doctoral degree at the point in which they applied for their training plan and the doctoral degree were to be completed, then they would have still had completed all the number of hours of additional supervision and practice that anyone who had already done it prior to the submission of an amendment would have done as well. So there's no differentiation between somebody completing it prior to their application and someone completing it during their application as far as the substantive value of the program, if that's the rationale. Am I making sense with that? So it seems like that's really like where we're a little bit confused, is that if a doctoral degree does make someone more equipped to be able to provide services to clients, and therefore we can reduce half of the time, then why would that need to be completed prior to versus during? Also, to one other thing real quick before we respond, most doctoral degree programs, the practice component of the program is done at the earliest onset of the program. And then the doctoral dissertation is usually the second half of the program, which is not a practice-based component of the program. And so we would say too, that would an ABD be considered enough, if someone were completed with all of their course requirements, the practicum, then would the ABD be enough to be able to meet this particular standard, if that's the rationale? So those are just thoughts we're throwing out. Yeah.
So essentially you're getting to, for psychologists, like, going on internship, right? Like psychologists have the year-long internship, and previous to the internship, they have practicum or practica experiences, and that components or those components are essentially half of the hours that psychologists would typically complete before they go on to postdoc, and they get the other half of the hours, and that would be the rationale for having half the hours of someone who would be doing their work on the counselor's level, right? That's essentially what you're saying.
Yeah, I'm saying, like, for those that you typically pursue doctoral degrees in counseling, their practice is both clinical and teaching and supervision.
Yeah.
And so a combination of a lot of things, all those things are done simultaneous to as the coursework, but then are all completed prior to the dissertation. So the dissertation is,
so I'm a clinical psychologist. So yeah. I know exactly what you're talking about. Like all that stuff is done ABD, and then you get your dissertation, and the internship is done ABD. It has to be done ABD because otherwise it's not an internship. It would be a postdoc otherwise. So you get the dissertation and then.
Yeah, our internships are done prior to the dissertation in the counseling degree.
Okay, yes. You would have to do your internship before you get the dissertation. Otherwise it would be a postdoc.
That's correct. Correct. All clinical work in a doctorate program in counseling is done prior.
Yeah, all of it is done before. Yeah.
Correct. So it wouldn't be uncommon for someone who's in a doctoral program who's pursuing second-tier license to have completed the practice experience in the doctoral program while completing the license. And so therefore should be given the same kind of credit for someone who did that prior to application for the LCPC. That's the kind of rationale we're coming to the board, because what we're understanding from the board's interpretation, at least for TON and for any other applicant, is that had to be completed. And in the statute, it had to be completed prior to the application. In the statute, it gives no definitive statement about when that had to occur. Did that have to occur prior to application, or could it occur during? Either way, it's the same sort of value to the applicant, is what we're arguing.
I'm a little confused about what the differential is here. So if you apply while you're ABD, while you're doing your dissertation, is your thought that doctoral candidates then who are working on their dissertation and have completed their clinical practicum internship should be allowed to start their postdoc hours while they're still ABD?
No,
is that the distinction you're making?
Honestly, we probably were a little bit confusing by adding a little component about pre pre-ABD and post-ABD. What we're really asking the board to consider is the fact that if someone completes a doctoral degree while in their training plan, that they should be given the half reduction. So in Tana's case, right, she's completed a doctoral program. She is completed most of the half of the hours that she would need towards her LCPC. And then the board responded by saying, no, you have to have had completed that prior to the beginning of your pursuit of your LCPC. And so we're just coming back to say that one didn't make sense to us. If a doctoral degree is what reduces the hours, then shouldn't matter when that doctoral degree occurs, as long as it happens sometime within the time frame of either pre-application or during the pursuit of the LCPC.
So are you saying that the hours that are done prior to the doctoral degree, if you've completed half the hours, that then once you get your doctoral degree, those hours should be considered done?
I'm saying that if you complete your doctoral degree during the time in which you are pursuing your hours towards LCPC, it should then, at the point that doctoral degree is conferred, it should cut those hours in half on an amendment to the training plan. So if I were to submit an amendment to my training plan, say I have completed my doctoral degree, therefore,
I now meet this.
now I meet the statute
Requirement.
requirement, yes. Rather
But
than having to happen prior to the application for the license.
But
I
the
mean,
hours that are completed are part of your doctoral degree. And if that's the
think that-
rationale, rationale for cutting it to half,
right.
then you're saying the half that they did before they got the doctoral degree, then once they get the doctoral degree, they should be able to amend and say, I'm done.
Yes.
I don't have to do any more. But if the
They should be able-
rationale for it being half in the first place is that you did half while you were doing your doctoral degree, then that doesn't pull through.
What
The
you
point
would-
of doing half
There's a
after is that you end up doing the total amount required, half before and half after, right?
I think
Good.
there's a little bit of confusion about the half and the half. There in the statute, it says they have the half supervision requirement after we've submitted a training plan. I think it got a little bit confused bringing in the doctoral work, because the rationale for the half is that we do a lot of extra work above a master's degree inside the program. And so that's why half the supervision requirements would meet the protective factor of protecting the public from the work that we're doing. What we're trying to understand is the training plan. So like, just to make it a little better understand, in my case, I was in my doctoral work, I submitted a training plan that had all the hours. That's what was sent back to me. And so then I was also ABD at the time. I'd already done all my coursework, and I think that's where it kind of got confusing. So I had already done all this extra supervision as part of my doctoral work on top of my master's degree. And then while doing my training plan hours and working towards my LCPC, I completed my doctoral degree. And so now I was thinking that based on what I was reading on the statute is with the doctoral degree, my supervision requirements as part of my training plan should be counted as half.
As well as the contact hours.
Yeah. So then does that follow?
I think I understand. I think I understand what you're saying. Yeah.
This is kind of what Missouri did when they did away with the postdoc a few years back. They said, you can pull through. This is the pull through that Missouri did a few years ago. They said, fine, if you've got the hours, you can pull through. And I mean, I think that there are arguments either way for allowing for what you are proposing. There are certain clinical programs for which the hours are not obtained previous to obtaining the degree. And that would be something that would need to be considered by this body. And then we would need to consider whether or not we would need to grant exceptions by the person if we were to change this if this were to be changed by regulation. So in regulation, it says, no, you can't do that, but it would require a regulation change in order for this to go through.
I don't think it would. If you read the
Yeah,
regulation, it says.
I
Oh,
was
go
going to
ahead.
say an
Sorry.
interpretation. Well, that's okay, Todd. I think there's, when I'm reading this, and I've read it a couple of times through the discussion, it assumes almost a sequential order of things. Like you will do this, every candidate looks like a master's degree, then a doctoral. And what you're really talking about is someone who's progressing in a more fluid process. And so your ask is then once they've met this requirement, it's a new change, that then those hours follow. And it's not, I don't even think as complicated as we're trying to think, well, do those hours count towards this? It's not even, that is not your ask. Your ask is really like, once a candidate's change occurs, why aren't we applying the regulatory standards that are already in place to that change?
Correct.
Yes.
Thank
Does
you.
that make
was
sense
very
to the
very
board?
concise. Yes.
So succinct
Okay.
and clear. Thank you.
Yeah. So it doesn't matter when that change occurs, if it occurs
Correct.
prior to the application or during, it should still, we believe it should still be applied. The half. Yeah.
Okay, for the board members in here, does that, any other questions or comments that need to be answered? Just want to make sure.
That wasn't how I interpreted that. The interpretation I have is a bit different. It's more static than that, but that is something that I will take into consideration offline.
Thank you. Any other questions or comments? I just really wanted to make sure we were having clarification on what your ask was, Dr. Fry, or your interpretation, because I think it was getting a little heavier, I think, in regulatory change than what you were intending.
Yes, right. We're not believing that there needs to be any regulation change. We believe that this is just a board interpretation, and want the interpretation to be, we want to understand the interpretation for it to be flexible enough to allow those with doctoral degrees to receive that benefit of the 1/2, no matter when the doctoral degree occurs.
And this is Lainey Barnard with the Attorney General's office. I would note, going way back to your question about if the board, anybody remembered what the rationale was. It looks like it was last amended in 2004. If the copy I have up is correct. So I don't think that any of us were probably around in 2004. That's my only comment at this point. Thank you.
Thank you for that, Lainey. Any further discussions or comments while our guests are here? It sounds to me like we might need to have some other conversation as a board to make sure we thoroughly understand this and have a consistent interpretation. Thank you very much for your time today, and I appreciate your being here and explaining your perspective. And hopefully the
Thank you
board
so
will
very
make
much.
a deliberation on it.
Yeah, thank you all for listening. Again, appreciate all your work that you're doing. Hope you have a great rest of your meeting.
Thank you.
Okay, bye-bye.
Okay. When David and I had spoken about this item, I thought this might be something that we look at the retreat potentially as well, just to see, again, there's likely other professions where this is written in similar type language and might need to have some further discussions or even assignments to committees. Okay, moving on. We are just now at the review of the minutes from the last meeting. So if you could take a minute and look back at the previous meeting minutes on July 11th. And if there aren't any comments or changes, I'll accept a motion to approve.
I would move to approve.
Thank you, Donna. Is there a second?
Second.
Who was that? I'm sorry. Oh, thanks, David. All those in favor, please say aye.
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 Any opposed, same sign. Thank you. David, we'll move to you for your executive director's report.
Okay, thank you, Mary. First, a quick update on the BSRB YouTube channel. In the future, I'll probably use this as an update to talk about outreach for the board because I think it falls under that category. But we're basically using this now as a performance measure as one of the ones that I'll be talking about a little bit later. But in fiscal year 21, we broadcast 25 board and advisory committee meetings. Last fiscal year 22, we broadcast 46 board and advisory committee meetings. And so far this fiscal year, we have broadcast 8 board and advisory committee meetings. And so since the launch of the YouTube channel in January of 2021, our meetings have been viewed 1,974 times, so nearly 2,000 times. So really applaud the work of the board and the advisory committees. I know that there are frequent meetings sometimes, but I really appreciate all the work that you do. And I know I have heard a lot of comments from the public from different groups who enjoy being able to go back and be more educated about the work that the board and the advisory committees are doing. I wanted to remind the board about some of the governor's directions related to the pandemic that do remain in place. The governor does still have a restriction about meetings inside state buildings. And so for our purposes, we're not able to hold board meetings or advisory committee meetings here at the office for all members unless we can provide adequate spacing for everyone. So that does remain in place. I will let you know if that changes or is relaxed in the future, but currently we are still under that. So that is one of the reasons why we have to continue to do some of these meetings remotely. In terms of an update on revenues and expenditures, I wanted to let you know that last fiscal year, we started the fiscal year in 22 with a little over $2 million in the BSRB fee fund. As of the beginning of fiscal year 2023, the amount in the fee fund was a very similar amount. It is a little over $2 million. So right now, our revenues and expenditures are similar, but I do expect that to change next fiscal year. I think we'll be spending additional money for a few different reasons. One, we expect to not have turnover in staffing. We probably will be having a few more meetings in person, so some of our savings related to the pandemic will be changing. And there will be some costs that we are going to be absorbing from some of the entities that we contract with. So I do expect that we will have a deficit, but that is by design. The board did lower some license fees in the last few years, but I just want to let you know in terms of our overall budget picture, we're still in very sound footing. I wanted to let you know the agency's budget is due to be submitted on September 15th, which is later this week. For the last couple of months, I've been doing a lot of work, working with the representatives from the Division of Budget, also talking to the different entities that we contract with for services, getting clarification on things like salaries and fringe benefits. And it's quite a bit of work putting together the budget for the agency. But as part of that process too, we submit a narrative to the Division of Budget that includes things like performance measures. And we do have 2 sub-programs for the agency. One is licensing and the other is investigations and discipline. And so when we have the full offsite board planning meeting in October, I'm happy to share some of those performance measures that we are going to go ahead and include in the budget and just give you some historical information on some of those items and what we project going forward. In terms of the agency's 3-year IT plan, we were asked to go ahead and submit a revised 3-year IT plan. I think all agencies were this year. We're being worked on right now. And I think there might be a publication later this year. Some of the items that we included under the BSRB 3-year IT plan included continuing to phase out aging technology. We did go ahead and move under the Department of Administration's Desktop as a Service program to replace some of our computers with laptops last year, and we're continuing to phase out some of the desktop computers with those laptops. We are also continuing to move towards having online initial applications through working with the Department Board of Healing Arts. They host our licensing software. We're also looking at ways to convert some of our paper records to electronic records. And so we've been having some conversations with the Department of Administration about that. And then we're also going to be continuing to require all employees to have annual cybersecurity training and continuing to make sure that our online renewal system is fully supported. We currently have over 90% of our renewals done electronically. So we're hoping that we can move towards the electronic initial applications, because we think that will speed up some of the process in terms of the processing of applications. In terms of contracting with other state entities, at the last meeting, I provided an update on some of the entities that we contract with. Since that time, I've had additional conversations with some of the others. Our second largest contract for contractual services with the Board of Healing Arts for our licensing system. We do spend about $70,000 per fiscal year on that licensing system. They informed us that there is going to be an increase of a little over $2,000 from one of the vendors that host the data for us. So we did ask if there was negotiable, and it was not. And so we are going to have to absorb that cost for the next fiscal year for our licensing system. But just to do our due diligence, we are collecting information on other outside entities and vendors just to make sure that the price that we're paying for our licensing system is competitive with other potential entities that could do it for us. Last board meeting, I provided some information on our contract with the Attorney General's office. And just to clarify, so that contract with the Attorney General's office is not directly with the staff members who come to our meetings. It's with the Attorney General's office itself, and representatives over in that office. They contract with different entities. Several years ago, this was provided to us as part of our 10% contribution. By statute, all fee-funded agencies contribute 10% of their revenue to the State General Fund. And it says that we are to be provided certain services for that. But a few years back, there was a decision made that certain agencies could begin to contract directly for the services they provide. And so we have had a $75,000 contract with the Attorney General's office. This fiscal year, we received an offer that was going to raise that amount by $12,200. And I spoke to you all at the last board meeting about that amount. I informed you that I was trying to get information from their office in terms of the number of hours that were worked, because I believed that we had taken on more of those responsibilities in fiscal year 22, and that was our attempt for sure. They did provide us the total number of hours, and there was a decrease of 160 hours when you look at fiscal year 21 based compared to fiscal year 22. So I did continue to negotiate with their office to see if there was a middle ground between the increase that they had proposed and what we had before. They were supportive of some of the things that we discussed, but they did not want to, what they informed me is that there's going to be a change in the Attorney General's office due to the election, and they didn't want to make too many adjustments given the changes that are going to be coming up. And so as of right now, I did go ahead and do what the board had requested me to do, to go ahead and sign an agreement for this current fiscal year to make sure that the board is covered. And so we are under contract, and that is for the amount that had been proposed. I am continuing to have conversations with that office. It may be something that we need to talk about more in the spring. The board did ask me to go ahead and continue to collect information about other potential entities that could provide those types of services. And so I have had some conversations with other entities, and I will continue to have those conversations. But I think right now, one thing I would advise the board is that let's just go ahead and proceed forward with the agreement that we have. I'll continue to collect information. One of the reasons that we have to have this conversation in public has to do with there are certain grounds by which the board can enter into an executive session to have these discussions, some of which are to get legal consultation on things like contracts, personnel. You can always go into there to have executive sessions about personnel, but due to the unique nature of a contract for legal services, we may need to have different legal counsel to be able to go into an executive session on that point. So I think for right now, what I would just advise the board is let's move forward with the agreement that we have in place for this fiscal year. I'll collect more information, and then we can discuss this matter maybe in the future at a future meeting. In terms of our expert review process, I wanted to provide an update to the board on that process. I want to say it's been about a year, maybe a little bit before that. We worked on an overall contractual agreement for the BSRB to contract with experts for certain license review cases. So for most of the professions under the BSRB, 5 of the 7 recognize a national accrediting body. And if an individual received their education from a program that is accredited by the national accrediting body, we are able to expedite those reviews of those license applicants. But if someone received their education from a program that had not been previously approved by the BSRB or was not from one of these national accredited bodies, then a different level of review is needed to ensure that the program meets the requirements and statutes and regulations. And so since that time, we have negotiated contract agreements with different experts. We currently contract with 5 different individuals to provide these levels of services. These are all individuals who have full-time employment, and so this is not a full-time position for the BSRB. And so, so the time to do these types of reviews can take about a month per review. So if we do get several, it can mean that there is additional time. So I just wanted to make you aware of how this process came about, where we are in this process. Currently, right now, we have good working relationships with these experts, and they do a good job, I believe, for the board, and we appreciate all the work that they're doing. But I just wanted you to understand how this process works and where we are currently at with that expert review process. I also wanted to let you know, for the disciplinary side of the office, there are times when the Complaint Review Committee provides a decision on a case, and when the CRC provides a decision, individuals have the opportunity to appeal. On some of these, the BSRB at times needs to bring in an expert to review that and issue a report. It's a slightly different process than a review of an applicant's file, but it would involve reviewing records and issuing a report and being available potentially to testify. So I just wanted to go ahead and talk to you. And if there's no objections from you, then I will go ahead and use a similar version of our expert contract for the applicants to use that for the CRC, those types of reviews. So yeah, if there's any objection, please feel free to let me know. But if not, I'll go ahead and work with our legal counsel and make sure that we have a modified agreement and then start reaching out to individuals so we can go ahead and take care of those experts for the disciplinary matters. Moving to a different subject. So one of the things that the board does is they oversee the work that I do for the BSRB. And so from time to time, I provide updates to the board just to let you know about things that I'm doing here. If you notice in the report that I provide to you, sometimes I note the staff meetings, sometimes I talk about review of employees' performances. I did want to let you know that I recently engaged in some supervisor training. These were 3 days of full-day training. They're provided by the Department for Children and Families, but they opened it up to a few outside agencies. So I did attend those trainings on August 11th, 18th, and 25th. Found them very beneficial. And so I think when we have another opportunity to send a staff member, we'll probably have Leslie Allen attend those. But just wanted to keep you updated in terms of my own professional development and also the professional development of our staff members here. Now, so I'm going to transition to some legislative updates. So last, I guess it was last legislative session, the 2021 legislative session, the legislature did pass a reciprocity bill that was House Bill 2066. And this bill called for an expedited licensing and processing time for certain military members, military spouses, and other select individuals. It also provided another tract for licensure that dealt with having a substantially equivalent licensing requirements or a similar scope of practice. Currently right now in statute, the standard for reciprocity is to have substantially equivalent licensing requirements. But this new bill would allow, in certain cases, for us to use a standard of a similar scope of practice. And so the bill also called for affected agencies to submit a yearly report to the Kansas Legislative Research Department by August 31st of each year, providing certain measures such as the average length of time between individuals applying for licensure under this and having a complete application, the average length of time between having a complete application and a decision being made on licensure. And so we went ahead and worked with the Board of Healing Arts to pull numbers and reviewed those during fiscal year 2022. They asked us for the number of licenses that we issued under this bill. And so we did issue 105 licenses, and they asked us for some of those timeframes. So based on the way that our application process works, an individual will send certain documentation, but we will receive other items as part of their application packet at other times. For example, we'll get their transcripts, we'll get references. We will follow up for additional information if we need more information concerning their school. So the average length of time for all these individuals which includes military members, military spouses, individuals who are Kansas residents, and individuals who are intending to reside in Kansas. For the group that was applying for reciprocity under this, the average length of time between when they applied for licensure and a completed file was about 30 days. And then from about when they had a complete file to when a decision was made, the average length of time for when a decision was issued was about 5 days. So I think we did a good job under that standard, and we'll continue to keep track of those totals. And if you have more questions about that, please feel free to let me know. But that was turned in to KLRD, and expect that they will be combining our numbers with a lot of other numbers for agencies for a bigger report probably. In terms of other entities, I have been asked to provide testimony on September 27th to the Robert G. Bob Bethel Joint Committee on Home and Community-Based Services and CanCare Oversight Legislative Committee meeting. That is a legislative meeting that looks over a number of different health-related topics. The reason I've been asked to testify in front of that group is that there was a legislative committee that met, and that was a special committee on mental health modernization and reform that met the fall of the last 2 years. They issued certain recommendations. And so for individuals that had they had identified certain agencies that were the primary agency responsible for these recommendations, and then others that maybe have a connection to the recommendations. And so for the BSRB, we are not listed as the primary agency for any of the 4 recommendations, but I have provided you with a copy of the recommendations that do have a connection to the BSRB, and they are 1.4, 10.1, 10.4, and also 10.5. So I'll be attending that meeting and just sharing some of the work of the board and some of the conversations of the advisory committee as they connect to some of the recommendations that were made by that legislative committee over the last couple of years. Additionally, we have a number of rule and regulation changes that are working their way through the system. We had turned those in a while back, and then a bill passed during the legislative session that made us have to go back and change our process on those. And so we resubmitted those, and they have been working their way through the system. We did receive confirmation that those have been approved for a public meeting for those. And so we submitted those regulation changes to the Secretary of State's weekly publication. And we published for there to be a public hearing on the regulations on November 8th at the BSRB office. And so generally those are just an open meeting. If anyone wants to attend, they are welcome to do so, but it is not scheduled as a traditional board meeting. It is just an open forum, and so individuals can come to attend, or they can go ahead and provide something for consideration on those. And so we're going to be collecting information at that November 8th meeting and then sharing it with the board if we have public comments on those regulation changes. Additionally, I was contacted just over the weekend by a representative from the Kansas Legislative Research Department. They have scheduled a meeting for the Joint Committee on Administrative Rules and Regulations, and that is going to be on October 18th. And they have asked me to come to the committee to talk in more detail about the rule changes that were approved by the board. So we do have another couple of meetings that are already scheduled that day, so they'll have to do some movement with the calendar, but that's where I will be on October 18th in front of the legislative committee to talk a little bit more about our rule changes. And then as far as some other updates, we are a member of the SIPAC, Psychology Interjurisdictional Compact. They had a mid-year meeting on August 14th. They did pass 2 provisions to allow for public comment on those 2 changes. The 2 changes were essentially just to give them the authority to charge an annual fee for individuals that are practicing under SIPAC if they have either the ability to provide telehealth services or a limited number of in-state days. When they originally set their rules, they didn't provide for the ability to do a renewal fee from those individuals, but they went ahead and approved that to open up for public comment. Information on that is on the BSRB website, and the time for public comment is open through September 27th, 2022. There was also a meeting of the Kansas Fights Addiction Grant Review Board since the last board meeting. That first meeting of that group was on July 14th. It was here in Topeka. There was a presentation by the Attorney General who talked a little bit about the federal litigation and the bill that was passed that formed this board. There are some national lawsuits and the amount of money that Kansas will get in relation to these. Some of that goes to local units of government and some will go under the authority of this board. And when everything is fully set up, individuals will be able to provide essentially grant request to provide services on fighting addiction. And so the board had an initial meeting. A lot of the meeting was basically preliminary discussions. They just discussed things like the Kansas Open Records Act, the Kansas Open Meeting Act, and did some initial training for the members, but they do plan to meet again. Another meeting date has not been set, but I believe it will be likely to be at the last week of September. So when I know that information, I can go ahead and answer any questions from individuals when that date is set. I do know that on the Attorney General's website, there is a separate page for the Grant Review Board, and they are posting updates to that website. So if any individuals from the public want general information on that, there is a dedicated page to that on the Attorney General's website, and I believe they'll post the date of that meeting when it is established.
David, it's Lainey. I just had a quick question. Was there something in the statute about the requirements for the person, the representative from BSRB being on that board and that they should be an expert? I think you attended that first meeting is just because it came up quickly. Does there need to be a conversation about how the board's going to select their representative for that board?
I think that would be helpful. Yeah, at the last board meeting, I mentioned that the language in the bill indicated that the person who is serving on that should have experience working in different addiction, those types of services. And so the board had initially appointed me to be the board's representative, but there was going to be discussion about if the board would want to name another individual to serve in that capacity. So I am happy to attend those meetings, but I do think it is probably a good idea for the board to consider naming another individual to serve in that spot.
Yeah, I know. Thank you for bringing that back up, Lainey. That's something David and I talked about as well. And I don't know if this is, again, it's sort of newly forming, but we also don't want to get too far behind the information that's coming out about this. So I'm wondering if the board would like to talk about that now or get some more information. I'm just feeling the same thing, that we should probably be in compliance with that requirement sooner than later, now that we know a little bit more about that. We certainly have some addiction expertise in our board membership, if that's a direction we want to go. Any questions or
I was
comments?
trying to pull it up real quick, and I don't even think that it necessarily has to be a board member. It's just an appointee of the board. So just.
Okay, thank you for that clarification. Deb?
Yeah, that's what I was going to say as well. And I think we need to think about kind of the longer arc of this. So.
Any other discussion?
It would make sense to me to have an addictions counselor be the appointee, whether it would be a member of the board or outside the board. If the arc of it's going to be for several years, possibly beyond the term of a board member, it would make sense to have someone outside the board be appointed.
There are certainly some very long-term system-oriented folks on the Addiction Advisory Committee to consider.
Well, and that's what, I'd like to hear from the board members, is if there are recommendations that we could consider. And with you leading that, Deb, I think you would have that knowledge best, but there might be other advisory committees where there are addiction professionals on there too, and I wouldn't want to exclude those.
I guess this is Lainey again, just practically, I wonder if you just push out the information that this is a position that needs to be filled. People can nominate people can apply, and essentially fill out an application to be the board's spokesperson, and then just consider all those applicants. The board can have a discussion on who they would like to represent the board.
Yeah, I like that idea.
Otherwise.
Yeah, I like that idea, Lainey. It gives it a formality, and also we can ensure that we get enough potential people to serve in that capacity and those who have some capacity to serve for a while. That would be helpful as well. So is the board in agreement to have David get an announcement pushed out, similar language as Laney's proposing with an application process? In my mind, I'm likening it to how advisory committee members come on to those positions, et cetera. Does that sound good to everyone?
I'm good with that. I think a couple of things. Anytime, I know I'm considering whether I want to do something, I need to know what the time commitment is. And so I know that's been a bit of a question with this particular board. So as much clarity as we can get about that as we send out that announcement will be, I think, helpful. And then the second thing is, I guess in my mind, especially as I've filled certain advisory committee members on my group, there is a difference between folks who have experience at some sort of system level versus those who do not, in terms of, frankly, their comfort level at times, even with participating in these kinds of things. So I just think some sort of additional piece about that would be helpful, not only for the person, but also as we look at who might be the best fit.
Yeah, so some, not job description, but some certainly language in there that discusses an ideal candidate for this role. I appreciate that, Deb. Any other questions or comments?
If part of your concern, though, is to respond to this relatively quickly, it seems like that process is going to take a while, not only to send it out and then wait while people respond, and then somebody's going to go through and look at all those applications. When we've got a group within our board and advisory committee full of people, and I wondered if Deb had any specific recommendations.
I do. I have at least two that come to mind readily. I would definitely want to see if they have time or interest. I have potentially 3 others even. So many of the folks on my advisory committee have that system experience or have been in the field for a long time. So I do feel good about the pool there, but I'm deferring to the group's will on the process. I don't know how soon they're going to meet. I suspect the governor's race is going to slow some of this down a little bit, but that's just me guessing.
Yeah, at the initial meeting, they talked about, at least there was some interest in meeting every month. And then we didn't really hear anything for a little while. And then about a week and a half ago, they started checking to see availability for the next meeting. And so I believe it's likely to happen at the end of September, maybe the last week in September. But I don't know the frequency at this point.
And I think that to just that point, we would want you to continue to engage in that until we had a more formal selection. So just based on that, I think we could, not unlike us, to do a little bit of both, where there is a more formal process, but there are also people that we might be recommending or asking to see if they're interested in that type of role. That makes sense to me as well.
The board could consider also, I wonder, because you have individuals that have the criteria, maybe appointing somebody as an interim on an interim basis, and then that would give you the time to go through the formal process. You get a little bit of both. You get an expert in there immediately while you do your due diligence and review, everybody who'd be interested. But just a thought.
That person would also then be able to develop a clearer picture of what the time commitment's going to be, how often they're going to meet, et cetera, so that for the permanent appointment, we'd be able to offer a clearer idea of what people are signing up for.
By the way, I went ahead and pulled up the statute. So in terms of the language of the requirements for the individuals, it does say that there would be, and this is 75-778. It says the board will be or shall be composed of 11 members who have expertise in the prevention, reduction, treatment, or mitigation of the effects of substance abuse and addiction.
So another idea is presented on the table. Is the board interested in appointing an interim person? I'm again making an assumption it would have to be from this board, since we need to make someone an appointment. If we did that, we'd have to do that pretty quickly. Or are we wanting to follow the process we sort of had in place, which was David's handling that while we do this other process? What are the opinions and comments of board members?
I guess I don't see any harm in David continuing to serve in that role, just for continuity's sake. Whether we choose to entertain a couple of folks out of my committee or go through a larger process, it feels like we can accomplish some of that, at least. I don't know, maybe not the next meeting, but the one after that.
I agree, Deb. Anyone, any other thoughts on that? So at this point, the board's decision is to continue to have David serve in that capacity as we select a permanent appointment to that group. And then secondary to that is, would the board like to take on a more formal process or lean on recommendations from an advisory committee? Or a little of both? I guess there's really three options on the table.
I think the hybrid, let's take recommendations from Deb's committee, but also open it up for other members of the community that might qualify.
Yeah, we can certainly establish some timeframes on that process as well, so it doesn't drag out.
I'm happy to help review any of those also, David, and to kind of streamline that process. Another option would be, I don't know, others haven't spoken up. I don't know if we have other folks on other committees that could potentially serve as well. Another option would be to just put it out to advisory committee members to apply. I think one of the advantages of that is that they are representing us. So some familiarity with what we do, the process and things like that, I think would be important as well. Not just someone else who maybe doesn't know all that much about the BSRB's work.
I really like that idea. Are there any other comments or questions from the other board members?
I think that's a good idea. I can't say that I know, there might be some licensees that might be on the social work committee that are duly licensed. I don't know at this point, so that would be good.
Yeah, I agree with what Deb has said. I think some familiarity with BSRB would be really beneficial in terms of if it is our representative to this group. So again, I think the idea of looking to somebody from specifically the Addictions Advisory Committee seems like a good idea.
I do too. So if I'm hearing what our ask is now of David is to, we want him to send that out to the advisory committees in general with some language around what we're really looking for. Is that what the board decision is here? And that he would stay involved in that until we had a permanent replacement?
I like that idea. The other thing that just crossed my mind was I think we want to formally set up a way for that person to report back to us, since David
Absolutely.
would not be doing that. So I don't know if it's please attend these meetings on some quarterly basis, at the beginning to give us a report. I don't know, or an email or something.
Good point, Deb. It'd be nice to have them on with a standing agenda for board meetings.
Well, and there may be some materials that those individuals have access to that would be confidential. based on the nature of the grant submissions. So just want to make you all aware of that too. So there may be some information they can provide publicly and then some that they might be restricted to. So.
Sure.
Fair enough.
Okay, do I need to make a formal motion with that, David, or are we good with that consensus?
I think consensus is fine, but just to make sure that I understand. So for the time being, have me continue to serve in that role, but you'd like me to send something out to each of the advisory committee members, letting them know that the board is interested in finding another individual to serve in this capacity and describing the position and the time commitment as far as we understand, and then the need to report back to the board to provide updates. And then they could probably send interest. Would you like them to send interest back to me or for that to be collected at the advisory committee meetings? I guess that's the only question I had.
I think it should go back to you because depending on the schedule of the advisory committee meetings, it would just make more sense that once you have all of those letters of interest or people of interest, then we could decide how to make that selection, but I think it would speed up the process.
Okay.
And would the evaluation be held with us, or was that going to be held within evaluation of the potential candidate? Is that going to be with us or with an advisory committee? I can't remember which one we said.
I think it needs to be considered by the full board unless the full board delegates it to
Okay.
a specific committee.
All right. Thank you.
Oh, do we want to
Okay.
direct David to narrow the field down in some way? I guess probably won't have as many applicants now.
Would he have the ability to say if we put in, you know, a couple of statements around expertise in the addiction field, you know, these requirements, he could knock out people who maybe didn't have those broader that broader criteria. Does that make sense for everyone?
I think that language should be in the letter inviting applications, that specific language.
Does that clear, David?
Yes, I believe so.
Okay. Great discussion. Was that the end of your report?
Just have a few more items. One, we were approached, Leslie Allen and I were contacted by some representatives of the Kansas Department of Health and Environment, KDHE. There is a system that is formerly called KSERV. It's now called the Emergency Response Volunteers in Kansas, or SERV-KS. This is essentially a group under KDHE that is trying to coordinate efforts should we have a disaster in Kansas and there is an immediate need for health professionals in different areas. They want to be able to allow individuals to volunteer to be a part of these types of services. And so they had contacted us and they were trying to see if the board wanted to have something on the website or endorse them. They were going to be continuing to look at some other information and then get back to us for further conversations on this. But I told them that in general, the board really doesn't endorse different groups. But on this, it's something that has been around for a while. I'm not specifically familiar with it in great detail. And I think in general, it's applied more to individuals in the physical medical fields. But I wanted to make you all aware of those conversations with them and that they will be connecting with us in the future to provide more information, and maybe they'll have a more formal request of the board in terms of having a link on the website as far as if individuals wanted to volunteer to be part of this KSERV or SERV-KS. So I want to make you aware of it now to kind of preface that if it comes up again in the future. So,
David, these would all be licensed individuals?
Yes, that's right.
Yeah, this is something I've done for years with their radioactive materials. And I do think, I look forward to hearing what their proposal is, but I do think it's important should the need arise in a disaster situation for licensed individuals that want to volunteer and you need a coordinated effort through a disaster plan when the state is deploying resources. So it makes sense, but look forward to hearing their proposal.
David, it made me have another question. You know, you currently make a statement about that when you're renewing your license about whether or not you'd be willing to be called in an emergency. How would that be coordinated currently?
So I think that was one of the things that they brought up in our conversation. They said that they have been asking for that information from certain people, but there really hasn't been a great way to coordinate those responses to put together a group of licensees that, you know, should something happen, I think there have been different pieces that have not been connected in the past, and they want to make it more of an integrated process just in case something should occur. So.
I'm a disaster mental health responder for the Red Cross. And so there's already that network available for any disaster that would occur, but it's regional. So actually the Kansas City area is in the Missouri, Arkansas region. So most of Kansas would be in a separate region, but I wonder if it would be helpful for them to coordinate with the Red Cross because they already have that system in place.
I'll bring that up the next time we talk to them if they reach out to us again. I wanted to make the board aware there is so we as a state entity that licenses professionals, we have agreements with certain associations, and a lot of those national associations we pay dues, and as part of that we are a state that is able to use a national examination for different groups of professionals. And so for the social work profession, the Association of Social Work Boards, or ASWB, has different examinations for different levels of licensing under the social work profession. They recently released a report that had breakouts of demographic information for how individuals had done on the different types of examinations offered by ASWB. And it did show some differences between different breakouts and different demographic groups of individuals who had taken those examinations for licensure. And they have started opening up some town hall type sessions to discuss the release of the demographic data. A lot of individuals are discussing those recently. I wanted to make you aware that there are some resources in the full report where you can access that. So on the main website for ASWB, aswb.org, it does have links there to the full report of the demographic data and the breakouts there. There's also some different actions that ASWB is doing in response to that. And so I want to make you aware of the release of that report, and also where to go ahead and learn more information about that report itself, and also some of the resources. We've had conversations about different multi-state compacts in different professions. They just recently released draft language for a social work multi-state compact that is open for comment right now, and the representatives from the Council of State Government, or CSG, have been providing certain meetings so far to go over details of that compact. There is no current deadline for public comment, but if individuals want to provide comment, they are certainly welcome to do so. Right now, they are not sure if the full language for the multi-state compact will be available for this current legislative session or for the following legislative session, but that is their goal, at least to have it ready for states to consider by fiscal year, or by the 2024 legislative session, if not before. And then I provided some dates of other meetings. I just wanted to highlight a couple of things on here. At the last board meeting, we talked about the board wished to have an annual offsite planning meeting. The date of that has been set. That is going to be on October 24th, and that will be in Olathe, Kansas. And we'll post more information as far as the location on the BSRB website. That is a Monday. Additionally, I will be attending 2 upcoming national association meetings. The first will be October 26th through 30th, and that's the Association of State and Provincial Psychology Boards, ASPPB. Their annual meeting will be in National Harbor, Maryland. And also November 17th through 19th, I'll be attending the annual meeting for ASWB in Scottsdale, Arizona. And just one comment I wanted to make in terms of the budget process. I'll have more information on the total numbers for the budget when we have our offsite planning meeting, and I'll share information on performance measures. But one thing that I did want to go ahead and make sure the board is aware of. So we have membership in these associations in part because of the examinations that they offer to our licensees, but they also provide a lot of helpful resources for individuals who are going through the process to become licensed. And they have a lot of conversations at these national meetings about what other jurisdictions have experienced in the way of problems or creative solutions. So these meetings are really helpful. And one item that I'm going to be putting into the budget is some additional funding for board members to attend some of these national meetings. I know board member engagement is especially challenging with all of the remote meetings. And I think if we can have more board members have at least the option to attend some of these national meetings, I think it'll be helpful in taking back some of these ideas to Kansas as well. So just wanted to make you aware of that. And I'll have more details for you at the next meeting when I have the final numbers for the budget submission. So with that, I'll go ahead and end my report and answer any questions.
Thank you, David. Any questions or comments? Okay, thank you very much. The next item is the staff reports. I'm wondering if the board would be willing to make a change in the order of our meeting agenda and call for a break now. We've been at almost 2 hours, so and if that makes sense for everyone in the board, we could take our 10-minute break now. Would that be acceptable?
Yes, please.
Okay, I'm not the only one, Deb. Thank you. Okay, that it is, my clock says 11:53 right now. So if you would be back at 12:03, that would be really wonderful. All agreed? Okay. Please just mute and stop your video. You don't need to disconnect. Is that correct, David?
That's correct. And I'll put people in the waiting room, so that should be fine too. So.
Okay, welcome back, everyone. Do we have everyone in the meeting, David?
There's still a few individuals whose screens are not turned back on, but we do have everyone back in. So
Okay, great. And just a reminder to everyone that we still, the live streaming is resumed. So we are live streaming again, and we'll resume back to the meeting agenda item where we left off. Since Leslie Allen is not here today, David, I think you're going to make her staff reports, the staff reports.
yes, and the one thing I wanted to highlight is we did provide another copy of our historic totals for all licensees, so that is in your packet. So if you have any questions on that document, please let me know.
Any questions or comments on the license document?
Oh, and
Here.
Mary, one thing I do want to kind of fit into this category. I mentioned earlier that we do have the public comment meeting on November 8th for the regulations. For individuals, this was also in the Secretary of State's publication, but if individuals want to take a look at the changes to the regulations, those are posted on the BSRB website under proposed regulations, and those are separated out by the different professions that they would affect. So just want to highlight that for you too.
Thank you, David. Any other questions or comments? Okay, we'll move on then. And we're on to the Complaint Review Committee report. Cindy, are you on? There you are. Hi, Cindy.
Hi.
And the board will notice that there are documents attached with the Complaint Review Committee report. Please go ahead, Cindy.
Just very briefly, you have the statistics from the Complaint Review Committee, which meets every other month. I just wanted to highlight this time that it is the beginning of the fiscal year. And so that although we don't have very many cases, the last Complaint Review Committee in August, we had a record number of cases that we had since I've been here, but also we had as you are all aware, we have many new members on the board, and we had many new people on the Complaint Review Committee, including a new Complaint Review Committee chair. And it takes a lot of time to be on the Complaint Review Committee, and it can be very overwhelming to be on the Complaint Review Committee, especially if you're new. It takes a little bit of time to get used to all the terminology. So everyone on the Complaint Review Committee got welcomed with a very large number of cases. And so it really isn't that difficult. We don't have that many cases every time. I kept trying to tell everybody that, but that really, really is true. But that would just be the highlight. If you look at that, that would be the highlight, is that we had, or low light for people that were on the committee, that we had a very large number of cases, and that we had many new people who handled that very well.
And Mary, one thing I'll add on there about the Complaint Review Committee report. So you mentioned you have a packet of material that includes the numbers on the cases reviewed by the CRC, the RAB statistics for 2023. On the third page of that, there's a title document that says RAB statistics for fiscal year 2023. And there's two groups of numbers there: the cases opened by license for fiscal year 23, and then the cases reviewed for fiscal 23 by license. And so we have taken this document, and in response to what the board had requested last board meeting, we've added a couple of new columns of information to this document. There was a request by board members. They wanted to see, I think they wanted information to put these open cases and the cases received in the context of how many licensees we have in those different groups. So we have mashed this up with the new reporting of how many permanent licensees we have. So now you can see how many cases we received, and then in comparison, how many permanent licensees are in that group. To avoid double counting, There may be individuals who hold more than one license, and so we assign it to what we can try to assess as that individual's primary license. But these are the numbers. So you see the number of permanent licensees in that fourth column, and then in the fifth column, you have a statistic there, and that is the number of report of alleged violations divided by the number of licensees in that category. And so if you look at the total line, you will see a number that on the top table, it says 0.0067. So what that number means is that for all of our licensees, in terms of how many open cases per licensees, we establish a base number there for all licensees total. And then if you want to look above that for any particular line, if the number has a higher number, it means that for that profession, we're seeing proportionally more, or if it has a lower number, proportionally less. And so you can see, because it would make sense that the number of licensees that we have where we license the most individuals, we're going to have the most complaints in that area, just as a numbers game. What this attempts to do is it attempts to say, we're taking these per license groups. And so you can just see for that category, is that category having more RAVs than a normal percent of licensees would have. And so you can see that by the open cases in the top table and then cases received in the bottom table. So this is an attempt to kind of reflect that. So you can see, is there a group that is getting proportionally more complaints, not just as a larger group of licensees, but as it relates to that profession compared to other professions. So wasn't sure how to reflect this number, but wanted to start with this to try to match what the board had requested. But if you'd like us to tweak these or put it in a different context, we're happy to do that too.
Yeah, thank you for that explanation, David. I think context is always important when you're looking at raw numbers. For the board, any comments or thoughts, suggestions about how this new version is laid out?
Helpful, pretty much what I was wanting. So thank you very much.
You're welcome.
All right, hearing none, we'll move on for that. Cindy, thank you for the report, and thank you also for acknowledging the new members to the committee, because it was a heavy meeting. Jim, I see your hand there. It was a heavy meeting, so we appreciate the tutorial to getting people into the process pretty easily. Jim, did you have a comment?
Just one question. Does the board feel we have adequately provided the public with information they would need in order to file a complaint? In other words, it went from nowhere in 17, of course, to I'll call I have two PCs in my life. It's pre-COVID and post-COVID. So the numbers seem to have scaled from nowhere to a little to nowhere to zoomed out of control probably during COVID and now back. But my question really is not related to the numbers themselves, but have we provided the public with the information they need in order to file a complaint regarding the provider?
I mean, David, I'll let you handle that. I do know that it's very prominent on the website, on the BSRB website, how to file a complaint. So that's pretty simple, plain language. But David, Cindy, any thoughts from your perspective?
Sure. Yeah, we do encourage people to file complaints if they believe that there has been a violation. And I believe maybe what you're referring to is on the second page, there's a box that says cases open by fiscal year. Those totals there, what that table right there, that little box of information, what it means is currently, if you look at the open cases before the investigators, how many of them are cases that were opened in each of these fiscal years that still remain? And so the ones that have been completely dealt with and resolved, they are removed from these numbers. But if you want to say, for example, how old are the cases that we're currently considering? Well, 25 were filed after July 1st of this year. And then 59 were filed during the past fiscal year. And then there's 7 and 21 that still remain, 4 and 20 that still remain, and then 3 and 18 that still remain. So for those specific fiscal years, if we looked at all the ones that were filed during those years, that would be a much higher number, but all the ones that have been resolved are gone. And so when you're just looking at a snapshot of today, these are the ones that still remain and when they were originally filed.
In answer to your question, in the past, let's just say 5 years, we do a very good job of informing the public, and we do a very good job of communicating with the public over email and the telephone about how to file a complaint. And we do not encourage or discourage someone to file a complaint. We have the same messages for people and how to communicate with people about how to file a complaint. And we'd be glad to talk with you privately how we do that. But one of the things that we have is if their staff is not available, is we have frequently asked questions about how to guide them through the process, because a lot of people use the internet now, and we have a complaint form on the on our website, and we also have frequently asked questions to help guide them through the process. And so anytime that we find a new mechanism about what other agencies have used or other states have used, we try to adapt that and put that in our repertoire to try to use that to help people file complaints or speak with people to guide them through the process.
Okay, thank you.
Other questions or comments regarding the complaint review committee report? Okay, thank you very much, Cindy. We will move to the professions report. We'll start with licensed psychology.
Okay, I can go ahead and handle that because Rick is out today. The licensed psychology profession met on August 2nd, and the two main items that they discussed was they continued to review the unprofessional conduct regulations and highlight for discussion items that could be considered for changes. Additionally, they started a discussion about accreditation standards. So for the licensed psychology profession, it is one of the professions that does recognize a national accrediting body. However, the statutes and regulations that basically talk about other ways individuals could qualify for licensure if they did not attend a program that's accredited by a national accrediting body. Some of those statutes that were initially based or linked to some of the accreditation standards may be helpful to be reviewed at a certain point because the accreditation standards for the national body have changed. And so our statutes and regulations reference things that maybe the national accrediting body has changed from. And so it started a conversation about reevaluating those. And so, but that is what the two main topics that were discussed at that meeting. And the next meeting of the licensed psychology profession will be on October 11th.
Okay, thank you for that, David. Social Work Advisory Committee.
All right, so this month we have the pleasure of adding Cynthia on to the advisory committee. She will be facilitating the advisory committee starting this month. So from now, she'll be reporting out during these meetings. Really, David covered all of the items that we touched upon with the new compact and also the ASWB testing scores. So those things we will be diving into a little bit deeper next month. Additionally, we are still trying to figure out, I think, working alongside the board with a couple of recommendations from the Social Work Advisory Committee with regard to bringing back the topic of supervision and also figuring out how, if it's possible, to make diversity, equity, and inclusion a requirement of CEUs. So Cynthia, do you want to add anything?
Nope, I think you covered it.
All right, thank you.
Andrea, when you said bringing back the topic of supervision, and with what respect?
Yeah, I think so. This is one of the things that the Social Work Advisory Committee, we sent out a survey to all of the individuals on our mailing list. And the feedback that we received is that people are interested in requiring that a clinical supervisor be approved by the board. And that is something that we would like to bring back up at some point to move forward with.
Thank you. Okay, professional counseling.
And I'll go ahead and take that report. So the Professional Counseling Advisory Committee met on August 1st. And they had representatives from the American Counseling Association and also the Council of State Governments, CSG, provide more information on a proposed professional counseling multi-state compact. They also had a discussion about reevaluating some of the license requirements for educational standards, talking about the topic of what degree a director of a program needs to have, the ratio of core faculty to non-core faculty, and did not recommend any changes in those two areas, but they did have a lengthy discussion on the physical presence component of the in-residence requirement. And they did not make an official recommendation, but they were supportive of removing the physical presence as part of that in-residence requirement. And they wanted to go ahead and take a further look at that at their next advisory committee meeting. And that will be on October 3rd.
Okay, thank you. Master's level psychology.
Yeah, we met August 31st. Welcomed a new advisory committee member, Travis Hemrick, who works at Larned State Hospital. Had further discussions around the in-residence issue, which we will continue during our next meeting. David shared with us some language that the licensed psychologists use in regard to allowing for more time for licensees to complete CEUs if they can show good cause, and there was support for that. We also started a discussion on the use of psychometricians, as one of our advisory committee members indicated that he was aware of a significant backlog in people being able to get psychological assessments done, but nothing, no recommendations have come out of that. And our next meeting is October 19th.
Thank you, David. In terms of the Marriage and Family Therapy Advisory Committee, we added 2 new members to the committee. And so this was the meeting where David conducted his annual training for advisory committee members. We did also talk about the in-residence requirement, and our committee is supportive of removing that physical space requirement in that. We also dedicated a group to look at a clinical supervision manual. There was a lot of interest in the advisory committee of doing something similar to what the social work group had done. We have another meeting October 14th. Addiction counseling.
Yes, the Addiction Counselor Advisory Committee met on June 24th, and I'm going to kind of sound like a rerun with everybody. We're still marching through our unprofessional conduct regulations. It's amazing to me some of the detail things that just really need to be cleaned up. Most of it will not be, I think, anything highly controversial. I'm happy to hear that so many professions are considering removing the in-residence, because that was definitely a resounding consensus in our committee as well. And so I expect to take that up Friday when we meet. And I expect we'll probably come to a decision to put forward. So addiction counselors have not, at least professions, their educational programs have not had any accrediting bodies that we've recognized. There's not a ton out there, but we're going to have a presentation on one that does exist, the National Addiction Studies Accreditation Commission. So we'll potentially be considering that. And then, of course, still looking at whether we want to consider any lower level licenses, such as a counselor assistant. I know one colleague had talked to me about basically master's level students who are getting their internship and in school and working towards clinical license anyway. And of course, at this point, when their internship is over, then they're out of a job. They can't really do anything until they finish up everything. And so do we want to consider, at least for that group of people, a temporary license that could continue while they're continuing to work on all of their requirements? So that's a tough one. Again, I think it would be made a bit easier to consider if other professions, like maybe social work, was considering this as well. I'm not sure how I feel about us being the only ones. So yeah, so that's it. We meet Friday.
Thank you, Deb. Behavior analysis. Oh, yeah, behavior analysis.
Yes, so we met August 1st. That was my first meeting with this group. So spent some time getting to know the advisory committee members and what they do. We continued discussion of unprofessional conduct regulations. One of the advisory committee members is volunteered to do a side-by-side comparison between BSRB and the national accrediting body, the Behavioral Analyst Credentialing Board. So we will be continuing that discussion during our next meeting. We also reviewed some possible changes to the Behavioral Analyst Licensure Act, but the committee is not recommending any changes at this time. We meet next on October 4th.
Thank you, David. Okay, moving on from the committee reports, we're now into old business. David, I think this was your item that you had brought up. It was discussion of the 988 National Hotline and the responsibilities to clients in crisis.
Yeah, so just for a little historical context, back in 2016, the agency I work for, High Plains Mental Health Center, became aware that some private providers in our area were putting on their after-hours voicemail messages for their clients that if they called and were in crisis, they should call the mental health center. Now, we didn't have any kind of formal agreements in place to provide that service for these providers. So we contacted Max Foster, who was the executive director at BSRB at the time, asked if we were correct in our assumption that BSRB licensure expectation was that providers be available to their clients who were in crisis or make arrangements with someone else to do that for them. I received an email from Max on 1/11/2017. Dave, can you share that so I don't have to
Sure.
read that to everyone?
Okay. Can you see the email on my screen now? Okay.
No, I can't. There we go. Okay. So as you can see in that paragraph, this is from the email January 11, 2017, that the board did discuss this at a meeting on January 9th, and it was their conclusion that if a person was providing mental health substance use disorder services, that they had to have the ability to respond to their clients or make formal arrangements. And if they didn't, then they would be in danger of violating a professional conduct regulation associated with their particular profession. So the issue is, it's not really in the unprofessional conduct regulations where it says that this is a expectation. It's my bet that this was a interpretation based on the board at that time. Deb, were you on the board then?
And I think Deb is saying yes. So.
I was, sorry, I was muted.
Okay, so am I correct in that it was kind of an interpretation of that? And
Yeah.
so, thank you. What we're hoping for is to formalize that somehow, either in the regs or in the application, where people would have to indicate that they understand that that is an expectation if they're providing those kind of services.
And Dave, I'll just jump in just for a second. In the packet of material for board members, on this item, you'll see a copy of the minutes from the board meeting from Monday, January 9th, 2017. And on page 4 of that document, you will see this discussion highlighted under new business A. So the text from that and the board's discussion that was in the minutes from that meeting has been highlighted. So I wanted to make sure you were aware of that in your packet of material as well.
We have used that email in the past when we've become aware that people have been telling their clients to call us. We've shared that with them, trying to have a friendly conversation around our understanding of what their license requires of them. But again, if they went back and looked at their specific regs, it would not be would be clear in there that that was an expectation.
David, what I'm trying, oh, go ahead.
Is the concern that people will refer their clients in crisis to 988 and that's doesn't constitute a formal agreement?
That is also a concern for sure, because 988 is an anonymous process. So people call 988 staff. There are 3 specific call centers in the state, and they're not routinely asking for people's names or whether or not they're in services. But part of it is really, the responsibility in the provision of these kind of services means that you understand you're also, as part of that, responsible for when things aren't going really well. To ask another provider to step in who isn't aware of the specifics of what's going on in each case, really creates a situation where the person who takes the crisis call might make recommendations that were actually counterproductive to the person because they don't really understand the case as well.
Dave, I'm kind of thinking about some of the nuances in what you're asking. So I'm thinking of it from the client perspective too, of anybody can use a crisis line, and that could be one of the resources they choose to use. So I'm trying to distinguish that from a clinician's responsibility to answer a call and handle that, who may need to refer to crisis to, for example, get a hospital admission for a Medicaid client. So I'm just, as this is sort of framing up and forming out, how do you envision those pieces?
Yeah, I think people, always have the right to use whatever resources are available to them. It's simply the kind of codifying the responsibility of the provider that they have to be available or have made arrangements. It doesn't mean that there aren't specific circumstances after kind of initially talking to somebody. They might say, okay, you really need to go to an ER, or you're going to have to I'll contact the local CMHC because they are the gatekeeper to the state hospital. That's the one statutory requirement CMHCs have. And I think with 988, this is a starting point for that. It's going to evolve, and hopefully at some point, if they did become aware that the person was in services with a particular provider, that they would have some ability to share that information to it. So at least the provider was aware, not necessarily of all the specifics, but hey, I might need to reach out to my person because they've contacted a suicide hotline.
Questions, comments from the board members?
David, I presume this has been discussed in your advisory committee?
Yes.
And do they have a specific recommendation that you're bringing forward?
Well, that was really the impetus for bringing this back or bringing this to the board was the discussion that arose out of the advisory committee. And then the question really was, what's the best way to formalize that expectation?
Because it's already in the unprofessional regs that they have to have a formal agreement, right? No, it's not.
No,
Okay.
I think that was the interpretation
Oh, okay.
of the board at the time, was that it would fall under that, probably kind of like abandonment of a client, but it isn't specifically laid out there. So I don't know what's easier, to have that as part of like the application or reapplication process, or whether the regs need to be updated with that specific kind of language. Jim, I saw your hand.
I just have a question. In the granting of a license in the state, does this board also, I'm going to use the term grant licenses or allow people to practice and govern practice names and standards and stuff? Or is it just the individual's license?
I'm not sure I understood what you're asking.
Okay, so in the place of the Kansas Dental Board, where I spent the last 8 years of my life, if a dental practice was not living up to this individual standards where the dentist was licensed under, the board would send them a letter and telling them clearly what the expectations were. But that was within the realm of the dental board, and I don't know what's in the realm yet of the BSRB. And I agree with David, it's a problem. They need to have their own follow-up. It's clearly there. I personally don't see any reason why we don't send them a copy of the letter from 2017, the determination of the board, and I would take this as a complaint personally, and
But there's,
go ahead.
if it's not in regulation or statute, the complaint review committee has no jurisdiction over it. So while we might find the behavior not the best behavior, if we can't tie it back to our regulations or statutes, we don't have any control over that. We don't have any jurisdiction.
So the letter from 2017 that we just looked at was not tied to anything. It was just a general feeling or impression. The one that said
it must have been because it didn't translate into anything.
I think that's the problem, is if you were to try to enforce it, I mean, basically you could have a professional saying, make me kind of thing. And then what? And so if you try to actually enforce some sort of sanction on their license without the statutory authority or the regulatory authority, then we would not probably go very far if they chose to fight it.
So there's no regulation or regulatory authority requires a licensee to practice within. If it's not listed specifically within the standard, we can't do anything.
Well, you guys can correct me. I'm really seeing this as probably falling under unprofessional conduct, that it would be spelled out. And then I think the onus would also be on us to issue some sort of public statement about that, with a backup maybe of the checkbox like we've talked about, but the checkbox in the renewal isn't going to be sufficient either.
Yeah. Well, again, based on what I'm reading at 17 and I'm new, it seems like this person is practicing in an unprofessional manner by abandoning their clients in the time of crisis. And I think somebody or some board or some entity needs to call them on account for that. And if it's not us, my question is who?
Yeah, and I do think at that time, that's what the board was saying, that if we wanted to, and that's kind of at the time, the conversations we had were around, hey, it's our understanding you really need to be doing this. Here's where we get that from. And most people we're like, okay, got it, understood.
Yeah.
But it's just not in there anywhere specifically. And now we're relying on something where there's only one person left from that board. I think Deb's probably the only one. And that executive director is gone. So it makes it harder to say, here's what you should be doing. And they could look at that and go, well, this is an email from a guy who's not even in that job anymore. And so finding a way to formalize that as an expectation so that it doesn't have to be based on the particular interpretation of the board at that time.
I think it would be really important to clarify formal arrangement. I always carried a pager, and if I was traveling, I had a colleague that would cover for me. But I knew a number of practitioners who their voicemail said, if you're in crisis, go to the ER. And, you know, the ER is officially there for emergencies, but those practitioners didn't have a specific agreement with the ER to cover their clients when they were in crisis. So we would need to clarify what that really means to have a formal arrangement to cover your caseload when you're unavailable. Unless we're going to tell everyone they have to be, you know, carry a pager and be available 24/7, 365.
Other comments or thoughts on this
Well,
topic?
that actually occurred to me that we may have to provide a definition.
Yeah, that's what happens when we do these regulation things, isn't it? Yeah, I mean, I'm definitely hearing that. I think there is a risk of an email interpretation from 2017 that doesn't have any way for us to refer back to it. And this does happen, I think, in limited aspects across other actions as well. How we formalize that, it does make sense that it would be under unprofessional standards since people have the responsibility to take care of their clients. So it sounds to me like there is support for languaging. Is that what I'm hearing, board? Yes, head nods. Okay.
But this would have to take place within each profession. You'd have to-
Yes, each profession has its own regulations. So my
Right.
ask would be that we take this back to our respective advisory groups, our advisory committees, and bring something back to the board. David, go ahead.
Is there BSRB staff or legal staff that could maybe give us a template of language that we could take so that we're all not kind of coming back with like somebody suggested, because those terms then have to have some kind of definition.
Yeah, I know that's helpful when Leslie sort of gives us some ideas going into those meetings. David, what are your thoughts on that? David Fye?
So I know that there is a larger conversation about unprofessional conduct regulations, and each of the advisory committees have been reviewing those. Some of them are still going through and identifying issues, and so it could be part of that conversation. I know at the end of this year, there's a goal to kind of summarize all of those ones that have been identified for possible changes. This could be included under that list too. I don't have any specific language, but I think if the advisory committees discussed this and brought it back, I think then the board could consider and see if there's a general recommendation that could be provided to the different advisory committees. But I don't have any specific language on it right now.
You know, I guess.
Go ahead, Jim. Go ahead, Jim.
I guess representing the public and the public interest, which is what I'm here to do. This has started in 2017. We're now be 6 years down the road. The mental health crisis is not going away. It's going to get worse. And I think if these types of, I'm going to use the term loosely, abandonment, and I know I'm on YouTube, it's, you know, but patients need help sometimes during odd hours, after hours, nights. And I think that the boards, the individual boards should consider that this type of non-support of a patient after hours or no arrangements can or might constitute patient abandonment during a crisis. And I think it's the responsibility, at least mine, to bring it up to this board. You're the professionals, but I think pushing it out to the committees with some type of license makes sense in order to make an addendum to the regulations that would clearly define this.
Thank you for that, Jim. So David, do you think that we could get some potential draft language to give to the advisory committees as a starting point?
I will try to look in the unprofessional conduct regulations and see if maybe there's something that we can use in relation to an existing regulation, and see if there may be some additional language that can be added on that point.
And I don't know if this is even possible, but if one of the advisory committees is meeting sort of first and has some ideas around that, it might be helpful then to share if that's permissible. Okay. Thank you, David Anderson. We'll move to the continued discussion of the BSRB investigation policy. We have a working document there that I think David's going to pull up so we can share and maybe get through the entirety of that document.
I'll go ahead and share my screen here. So I'm showing you, can you see my screen now with the investigation policy? I just wanted to circle back around to one item that we had discussed at the last meeting that I said I would bring back. So at the first item here, it talked about ways that individuals can file complaints. And number one can be a complaint lodged by a person. Two was other reasonably reliable written information. And we had discussed a social media post, and there was a larger conversation about electronic media. And then three, information that a licensee has failed to comply with condition or lawful order or directive of the board. And then information indicating a possible violation received during the process of the initial issue of a license, renewal of a license, or reinstatement of a license. And I think initially what we had done in terms of identifying the social media language here was to say, should we put this in the same classification? And this is not to say that if we don't have a language that people can't report things they see on social media. That's not what it's saying. Those can always go under the first thing. You can lodge a complaint by a person. If you see something on social media, you take a screenshot of it, or you take a video or an audio recording and send it to our office. Those are all still fine. The question is that if we see something in the newspaper, for example, under number 2, or there's something in a court decision that we're made aware of, we could go ahead and take care of that without having a formal complaint that's filed by a person. And so what I would recommend in looking through a definition of electronic media and some of the discussion that the board had at the last meeting, as far as, there's less verification in terms of maybe people putting fraudulent social media accounts that could be purporting to be one person, or there's less verifiable information because there's not the same level of standards as there might be in a newspaper, for example. What I would recommend is just let's not include electronic or social media under number 2. Let's just leave number 2 the way it is and just leave it as written information. And then if anyone wants to file a complaint about anything they see on social media, that can still be filed. It just will be under number 1, that they can file a complaint lodged by a person. So if they still see it on social media, they can still submit the complaint. But let's just, it would be my recommendation to go ahead and just not consider social media or electronic media under number 2, given all the complexities of the conversations.
Yeah, I agree. It simplifies the term written information, and it's still allowable, so it meets the the idea of being able to be a reportable action. Any other thoughts on that?
I just have a question regarding, this is how it's currently written. Is this currently in practice, this outline?
Yes. So if someone files a complaint, we will evaluate it. And then if we receive information that's in reasonably reliable information, we will evaluate it and we can submit something without having a specific complaint lodged by a person.
So I will just voice my skepticism regarding newspaper articles and yellow pages. Those very frequently in my world, since Walter Cronkite passed as an old man, newspaper articles and yellow pages, advertisements and advertisements in general are, I'm not going to consider them reliable at all. So I like court decisions, but other than that, I think everything should go to number one above. Just my opinion.
So your suggestion would be to not have any of the examples at all and just say other reasonably reliable written information.
An example might be, for example, of a newspaper article that would be like a marriage where you find out that someone married someone. That's something that was we've used in the past, where we found out that a client married a licensee. That might be the example of a newspaper article. An example of where someone was arrested, where a licensee was arrested. Those would be examples of newspaper articles that we used as factual.
And just to let you know, this does not mean that a violation has been proven. It would still go to the CRC for evaluation consideration. It just, we wouldn't need to have a specific complaint filled out in the traditional fashion if we received it under the written information.
And this is Lainey. I think it's up to the board and the committee, reasonably reliable. So everybody gets to determine, okay, is this newspaper article from Lainey's September thoughts and whatever, is that reasonably reliable versus, the Kansas City Star. So, and I do agree with Cindy, I think, who has mentioned that sometimes you hear about bad things, crimes charged, things like that via, and I think we saw that recently, via some sort of, announcement statement. So and again, you consider the source. And so if the Department of Justice is putting something out, I think you can evaluate that as reasonably reliable versus Lainey's September 12th blog. So I do think there are places where that you will get information via that source, just as a comment.
I would assume that assessment of any written material and what's reasonably reliable would include looking at journalistic standards, looking at the sources for that article, et cetera. So I think it's possible to assess whether something written is reasonably reliable.
Well, and it's just, if you kind of even step back a bit further, this process is really saying, and a complaint can be filed because of this. And so again, using the example of Mary Jones, clinician is arrested and that's on the newspaper, that would be enough for an investigation to be open. That doesn't talk about the determination of the investigation, the investigative process. It's simply a valid way to open a complaint.
Yes.
So can we agree that we won't use social media posts and leave the original language, or is the recommendation to take off any examples?
I vote for the former. Take out social media, leave the rest of it alone.
I
agree with that, yes.
Okay, great. Thank you.
Okay, can you see my screen again?
Yes.
Okay, I just wanted to circle back around to that. We had made a fair amount of progress through this document, so I just wanted to make sure that issue was resolved. I believe we are on page 9 of the document. So I'll move down to item number 5, or 5, the Complaint Review Committee procedure on page 9. And some of the changes that I'm going to be discussing are going to be largely going with the current practices that are not, we're not using certain forms that we had used in the past. So for number 5 here, there had previously been a consent agreement and order referral forms having at the CRC meetings for completion at the committee's direction. Especially now with us having remote meetings for some of these, it's not necessary to have those types of forms. We just need direction, and then legal counsel can move forward with the direction of the CRC on certain recommendations. So that's why that number 3 was struck there. On page 10, there was some language to clean up some of the phrasing under item B2. Just one grammatically, and then the other to replace law with statute or regulation so that we know we have violations of both. On item 4, we have other agreements other than consent agreements and orders. So we recommended replacing that language with settlement offer. For item 5, instead of using an aggravating and mitigating factors form, that the members can just consider any aggravating or mitigating factors when determining whether a proposed disposition of a case. And some of that is just simplifying the language in terms of how those would be resolved. So it could involve all of the same things that were discussed previously concerning the consent agreement and orders, recommendations from disciplinary counsel, but without specifying all that specific language, just kind of talking about disposition of the case.
But David, question, would that mean that there wouldn't be a need to have an assessment of aggravating mitigating factors as is crossed out there?
So
the purpose of the assessment is to guide the committee. That makes that optional.
So I think you could still consider those factors. There's just not a specific aggravating or mitigating factors form. It's just when evaluating all these things, it doesn't say that you have to use a specific form. You can just consider those things when you're considering how to dispose or resolve a case that comes before the CRC.
But it leaves it undefined about how we would gather that information about aggravating mitigating factors, or how we would assess if such existed. Correct?
Correct.
If we eliminate that.
Right.
How often has that been used? Anybody that's been involved in those?
Well, I would say that the CRC routinely considers factors and often requests further information from the complainant or the any of the parties actually. So the language here is the form that's being used versus having enough information to determine consequences or the action taken by the CRC. At least that'd be my 2 cents.
Has the form been helpful?
We don't use the form. Since I've been part of the committee, I've not used a form, but we routinely discuss aggravating and mitigating factors.
Okay. So this is
I think that's what
obsolete
David's
practice.
trying to clean. Yes,
Okay.
I think that's what David's trying to clean up is the use of a form.
Yeah,
Okay.
I think so.
It's part of the investigator's narrative. It's written into the investigation narrative that's presented to the CRC. It's not presented as part of an attached form.
And it's not a formal assessment like the risk assessment that they do for offenders to determine whether they get parole. It's not that level of assessment of mitigating factors, aggravating or mitigating factors. Am I understanding that correctly? It's not a formal assessment. It's just the investigator.
The investigator's impressions from their interviews and from the data they have and from the whatever evidence they have collected.
Okay.
Right.
Okay. Thank you.
On page 11, it kind of continues with that language, just not as specific as what was previously in the policy. For item number 6, There had previously been a victim impact statement to be filed. The committee could direct the special investigator to obtain a victim impact statement prior to finalizing the aggravating and mitigating factors form. Part of this is removing that language about that form. And then also, we really don't have a victim impact statement. That's just part of the narrative information that the investigators collect when they're investigating the case and putting together the file for review. So there's not as many separate types of these documents. It's just all included in the investigator's review when they present their summary that gets forwarded to the CRC for their review.
Can the victim be invited to give an impact statement? Still, even though there isn't a formal form?
So I think
Is that ever done?
they can provide any information related to the complaint for evaluation, and that does get collected by the investigators. One thing we do try to stress to individuals is that when they send a complaint to us, it really is between the board and the licensee. And so at that point, we want to understand the details of it. But I think sometimes it helps understand the difference between a complaint that they file under the board versus consideration of potentially civil litigation against the person. And Cindy, if you have any other comments on that, maybe in the past, in terms of a victim impact statement or anything.
I think that's a really good way to say it, that this is about the board and a violation of the statutes and the regulations of the state of Kansas. But we do follow up if we have any other questions. The other thing that I would add is that anyone can file a complaint at any time. And a lot of these come from licensees that when I say a licensee, they come from a third party, the person's new therapist. And sometimes we don't have contact with, you would say, quote unquote, a victim. They come from a complainant. We don't call people victims. That's not language we would use. We would talk to a complainant. We talk to the person who files the complaint. And so our contact is with witnesses and with the person who files the complaint, or with a person who provides us with information, who could be a client, who could be the person who was the licensee's client. But I would never use the language of victim.
Thank you for that, Cindy. That was helpful. I do want to be mindful that it is 1 o'clock. I know I have another meeting at 1 o'clock. And so David, is there just a couple more changes on this document? I don't know what the other board members, if they have other obligations that they'll need to jump off for, but I want to be mindful of the time.
Sure. There's a few more, but these are not time sensitive to today. So we can definitely hold these to a future meeting and I can just pick up from there. So.
Thank you for that. And so in terms of the remaining items on old business and new business, they will find themselves on the next meeting agenda so that we can bring those forward to this group. Okay, so we're at 1 o'clock, and if there are no additional comments, I think we need to make a motion to adjourn.
So moved.
All right, second.
I would second.
All those in favor?
Aye.
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 Thank you, Mary.
Thank you. Thank you all so much. Appreciate your time, and we'll see you soon.
Thank you, everyone.